Imagine being born already connected to another person, sharing organs, limbs, and even a heartbeat, and knowing that every moment of life is a race against time. Before we dive into this incredible and tragic story, tell me, where are you watching from? Drop it in the comments below. I want to see who's joining us today. In the spring of 1970, in a modest hospital nestled in the heart of Florida, a rare and extraordinary event occurred. A pair of conjoined twins was born, their bodies fused at the chest and abdomen in a condition known as thoracoomphalopagus. This rare form of conjoinment occurs in approximately 1 in every 200,000 live births. The twins, a boy and a girl, were joined in such a way that their shared organs and circulatory systems presented both a marvel and a medical mystery. Their birth was met with a mixture of awe and concern, as the medical staff, though experienced, had never encountered a case quite like this one. The parents, though initially overwhelmed, were determined to give their children the best chance at life. They sought consultations with specialists from across the country, hoping to find a solution that would allow their children to live independently. The medical community, too, was eager to explore the possibilities, recognizing the potential for both medical advancement and the ethical dilemmas such a case presented. As the twins grew, it became evident that their shared organs and circulatory systems posed significant challenges. The doctors explained that without surgical intervention, both children faced certain death. However, the risks associated with separation were immense. The twins shared vital organs, including a single heart and liver, making the surgery highly complex. After extensive discussions with medical professionals, ethicists, and the parents, a decision was made to proceed with the separation surgery. The medical team was assembled, comprising some of the best surgeons and specialists in the field. The operation was scheduled for the summer of 1971, a year after the twins' birth. On the day of the surgery, the hospital was filled with a sense of anticipation and anxiety. The operating room was prepared meticulously, with all necessary equipment and personnel in place. The surgeons, led by Dr. Richard Shaw, a renowned neurosurgeon, began the delicate procedure. The separation involved carefully dividing the shared organs and reconstructing the abdominal and chest cavities. The team worked tirelessly, aware that the slightest misstep could result in the loss of one or both children. Hours passed, and the operation continued, with the surgeons making slow but steady progress. As the day wore on, the tension in the operating room mounted. The twins' vital signs were closely monitored, and the medical team remained hopeful. Finally, after more than 18 hours, the separation was complete. Both children were stable, and the team allowed themselves a moment of cautious optimism. In the days following the surgery, the twins were closely monitored in the intensive care unit. Their recovery was slow, and complications began to arise. One twin developed a severe infection, while the other experienced respiratory distress. The medical team worked around the clock, administering antibiotics and providing respiratory support. Despite their best efforts, the twins' conditions continued to deteriorate. The infection spread rapidly, and the respiratory issues became more pronounced. After several days of intensive care, both children succumbed to their complications. The hospital staff and their parents were devastated by the loss. The deaths of the twins sent shockwaves through the medical community. The surgery had been a pioneering effort, and its failure raised questions about the ethics and feasibility of separating conjoined twins. In the years that followed, the case became a subject of study and debate. Medical professionals analyzed the procedure, seeking to understand what went wrong and how future surgeries could be improved. The case also prompted discussions about the ethical considerations of such surgeries, particularly when the risks are so high. While the twins' lives were tragically short, their story contributed to advancements in medical science and ethics. Their legacy lives on in the lessons learned from their case, influencing how conjoined twins are treated and how such surgeries are approached today. As the twins grew through their first months, the reality of their condition became increasingly evident. Their bodies, conjoined at the chest and abdomen, presented challenges far beyond those of typical infancy. Simple movements, feeding, and sleep were complicated by their shared anatomy. Even the most routine tasks, diaper changes, bathing, and clothing, required careful coordination and often two caregivers acting in tandem. Their parents, devoted yet exhausted, became acutely aware of the fragility of their children's situation. Doctors frequently visited, explaining in painstaking detail the implications of their shared organs. The twins' heart, partially divided yet fundamentally shared, was a constant concern. Any imbalance in circulation could destabilize both children simultaneously. The liver, although partially separate, shared critical blood vessels that made even minor infections potentially life-threatening. Surgeons discussed each risk in clinical terms, but for the parents, every conversation carried a shadow of fear that words could scarcely capture. The Florida hospital where they were born quickly became a hub of medical interest. Specialists from multiple disciplines, pediatric surgery, cardiology, anesthesiology, and critical care, visited to observe, consult, and advise. Ethical debates accompanied these consultations. Was it right to consider separating the twins, knowing the procedure could easily result in the death of one or both? Could they survive at all if left conjoined? These questions weighed heavily on everyone involved. Amid the medical consultations, the twins' day-to-day lives were not entirely defined by their condition. They exhibited moments of curiosity and delight. Their eyes followed the patterns of sunlight across the hospital room. They responded to voices with small coos, and their limited mobility did not prevent them from showing awareness of each other. For their parents, these moments provided rare relief from the relentless anxiety. Yet even small illnesses, such as mild colds, became urgent threats, requiring vigilant monitoring and sometimes emergency interventions. By the age of 6 months, it became evident that passive management was not sufficient. The twins' health remained precarious, with episodes of respiratory distress and circulatory instability occurring with increasing frequency. Each incident underscored the gravity of their situation. Without a radical intervention, their chances of survival beyond early childhood were slim. Medical advisors began to seriously outline the possibility of surgical separation. Preparing for such a procedure involved extensive planning. Radiographic imaging, angiography, and early exploratory surgery were conducted to map the intricate anatomy of their shared organs and blood vessels. Surgeons discussed in detail how they might separate the twins, what organs could be reconstructed, and which vital functions could be supported post-operatively. Every scenario carried enormous risk, and every plan included the possibility of fatal complications. The parents, initially hesitant, began to reconcile with the reality that surgery, though dangerous, was the only viable path to any chance of independent life. They met with ethicists, social workers, and experienced pediatric surgeons to understand the procedure, the expected recovery, and the potential consequences. The discussions were exhaustive and emotionally draining. The ultimate decision required balancing hope with the sobering statistical likelihood of failure. Finally, after many months of deliberation, the decision was made to attempt surgical separation. The procedure would be scheduled at the hospital that had nurtured their early life, with a carefully selected team of surgeons and support staff. Preparations included specialized operating rooms, extensive preoperative rehearsals, and consultations with anesthesiologists to anticipate every possible complication. Every moment was meticulously planned, yet everyone understood that even the most careful preparation could not eliminate risk entirely. As the twins approached their first birthday, the hospital environment shifted. What had once been routine monitoring became a quiet anticipation of the unprecedented. Nurses and doctors discussed in hushed tones the technical challenges, the ethical implications, and the enormity of what lay ahead. The parents, balancing hope and fear, held their children a little closer, knowing that the next stage of their lives would be defined by one day, one operation, that could either grant them independent life or claim them entirely. The twins themselves, unaware of the decisions being made, continued to develop in small, observable ways. They smiled, cooed, and responded to touch, a reminder to everyone present of the human lives at the center of the medical calculations. Their physical connection, which had posed such challenges, also created moments of shared comfort and instinctive cooperation. Even in these early months, it was clear that their bond was profound, so intertwined that any separation would not be merely surgical but existential. The stage was set. With months of preparation, consultations, and rehearsals complete, the hospital prepared for a procedure that had never been attempted in quite this configuration. Surgeons, nurses, anesthesiologists, and support staff all understood the stakes. Families of other patients came to witness the determination and care poured into the twins' situation. Ethical committees reviewed every step, and the parents, guided by love, hope, and the stark reality of medical necessity, resolved to place their children in the hands of the team, trusting that years of planning might overcome the almost unimaginable odds. The twins' story, already extraordinary by birth alone, was now entering a stage that would test every skill, every decision, and every ounce of courage in those around them. What began as medical curiosity had evolved into a life-defining drama, where the boundaries of science, ethics, and parental devotion collided. The outcome remained uncertain, yet the commitment to attempt the impossible defined this phase of their lives, setting the stage for the surgery that would ultimately seal their fate. The morning of the surgery arrived with a tense stillness that enveloped the hospital. The sun had barely risen over the Florida horizon when the surgical team assembled in the meticulously prepared operating theater. Every instrument was sterilized, every monitor calibrated, and every team member aware of the stakes. Outside the room, the parents sat quietly, holding each other's hands, their faces pale but resolute. The air was thick with a mixture of hope, anxiety, and anticipation. The twins were brought into the room together, their small bodies swaddled and their vital signs monitored with utmost care. Nurses whispered encouragements, stroked their heads, and ensured they were as comfortable as possible. The anesthesiologists, fully aware of the unique challenges, prepared an intricate regimen of medications to induce and maintain anesthesia without compromising the delicate balance of their shared circulatory systems. Dr. Richard Shaw, renowned for his precision and calm under pressure, took the lead. He had spent countless hours studying the twins' anatomy, reviewing imaging studies, and simulating the separation procedure in detailed preoperative rehearsals. The surgical plan had been mapped out meticulously. First, the shared circulatory connections would be addressed, followed by the careful separation of the liver and other shared organs. Every step carried risk. A miscalculation could result in catastrophic blood loss, organ failure, or death for one or both children. As the anesthesia took hold, the room grew still. Nurses adjusted monitors, surgeons scrubbed once more, and assistants ensured that instruments were in precise order. The first incision was made with painstaking care. The scalpel moved slowly, deliberately, as the team exposed the intricate network of vessels and tissues that bound the twins together. Hours passed in silence, broken only by the occasional technical instruction or the beep of monitors. The separation of the shared organs proved more complex than anticipated. Blood vessels intertwined in ways that preoperative imaging had only partially revealed. Surgeons carefully clamped, sutured, and monitored the twins' responses, aware that even minor fluctuations could prove fatal. At intervals, the anesthesiologists adjusted medication levels, balancing sedation with the fragile circulatory dynamics. Each step was measured, each maneuver considered for both immediate effect and long-term viability. Midway through the procedure, complications began to surface. One twin's heart rate became erratic, signaling distress. The team paused, reassessed, and implemented emergency interventions to stabilize circulation. Meanwhile, the other twin showed signs of oxygen deprivation, requiring delicate adjustments to ventilatory support. Every moment was a test of coordination, skill, and judgment. The room operated like a single organism, each member acutely attuned to the needs of the twins and to the actions of colleagues. Time stretched unrelentingly. Hours became an almost surreal blur of surgical precision, calculations, and constant monitoring. Nurses handed instruments, technicians adjusted lighting, and assistants recorded observations in meticulous detail. The parents, waiting just beyond the operating room, oscillated between hope and terror, their minds clinging to every fragment of reassurance offered by the surgical team. As the final stages of the operation approached, the separation of the liver and reconstruction of the chest cavity demanded extraordinary care. Surgeons worked simultaneously on each twin, coordinating movements as if their hands were extensions of a single mind. Slowly, painstakingly, the twins were separated, and their individual anatomies stabilized. The medical team allowed themselves a cautious sense of accomplishment as both children survived the immediate separation, a milestone that brought a fleeting glimmer of optimism. However, the operation was far from over. Post-operative care would be critical. The twins were transferred to intensive care, their bodies exhausted from the prolonged anesthesia and the immense trauma of surgery. Every monitoring device, intravenous line, and ventilatory support system was essential for survival. Nurses worked in shifts around the clock, observing the smallest fluctuations in vitals, ready to intervene at the first sign of distress. The initial hours after surgery were tense but hopeful. Both children were alive, and their vital signs, while fragile, suggested that the separation had been technically successful. Yet beneath the surface, subtle complications were beginning to emerge. The body's response to trauma, infection risk, and the inherent fragility of their organs created a precarious balance. The medical team knew that survival beyond the operating room was far from guaranteed. Outside, the parents were exhausted but remained vigilant. They were allowed brief glimpses of their children through observation windows, seeing the tiny bodies connected to machines and surrounded by a swarm of caregivers. It was both comforting and horrifying, a visual reminder of the delicate line between life and death. Every beep of a monitor, every whispered update from a nurse, carried immense weight. By the end of the day, the operation was complete, but the sense of relief was tempered by a profound awareness of the fragility that remained. The twins had survived the separation, but the most critical phase, recovery, was just beginning. The medical team remained on high alert, aware that the smallest complication could undo hours of painstaking work. The hospital became a crucible of tension, vigilance, and hope, as everyone braced for the days to come. The operating room lights dimmed, leaving the twins in the pale, constant glow of the intensive care monitors. The long hours of surgery had ended, but a new, grueling chapter had begun: recovery. Their tiny bodies, though technically separated, were far from stable. Every breath, every pulse, and every flicker on a monitor was scrutinized with painstaking precision. The surgical team, exhausted yet vigilant, knew the fight was far from over. In the first hours after surgery, both twins displayed signs of physiological stress. One's oxygen saturation fluctuated unpredictably, while the other showed increasing signs of circulatory strain. Nurses adjusted ventilators, monitored intravenous lines, and administered medications to maintain homeostasis. The twins' skin, pale and fragile, became a stark visual reminder of their vulnerability. Machines hummed and beeped ceaselessly, each sound marking the precarious balance between life and catastrophe. Complications, inevitable in a procedure of this magnitude, began to manifest. One twin developed a severe infection at the surgical site, which rapidly threatened systemic sepsis. Doctors administered broad-spectrum antibiotics and monitored white blood cell counts, but the infection's speed and intensity were alarming. Meanwhile, the other twin experienced respiratory distress, a complication likely resulting from fluid buildup and the body's response to prolonged anesthesia. Every intervention had to be carefully calculated. An aggressive treatment for one condition could exacerbate another. The medical team worked in continuous shifts. Specialists consulted each other at every turn. Infectious disease experts debated antibiotic adjustments, cardiologists monitored heart rhythms, and pulmonologists evaluated ventilatory support strategies. The room became a hub of coordination, as each caregiver's expertise contributed to an intricate and urgent plan to preserve life. Nurses moved with quiet efficiency, changing dressings, adjusting medications, and ensuring that lines and monitors functioned flawlessly. Even small errors could be fatal, and the staff operated under the heavy awareness of the stakes. Outside the intensive care unit, the parents grappled with despair and hope. They were allowed only brief visits, each glance at their children a mixture of relief and terror. Seeing their tiny bodies connected to machines and surrounded by tubes and monitors was heart-wrenching, yet the fact that the twins had survived the surgery offered a fragile thread of optimism. Conversations with doctors were clinical but laced with compassion, delivering updates while never sugarcoating the risks. Days turned into a tense continuum of observation. The infection worsened despite aggressive treatment. The affected twin developed fever spikes, hypotension, and signs of organ dysfunction. Attempts to stabilize with intravenous fluids and vasopressors offered temporary relief, but could not fully counteract the systemic deterioration. Meanwhile, the second twin's respiratory distress intensified. Mechanical ventilation helped maintain oxygenation, yet each adjustment carried risk, as the twins' bodies were still recovering from extreme surgical trauma. The hospital became a crucible of continuous vigilance. Night shifts were grueling, as subtle changes in vital signs could signal impending crisis. Physicians and nurses rarely left the room for more than brief moments, their attention fixed entirely on the fragile lives before them. Family members outside the ICU waited in anxious limbo, clinging to the hope that their children would stabilize. Every hour that passed was both a triumph and a test. Each minor improvement could be undermined by sudden deterioration. As the 5th day post-surgery arrived, the situation grew increasingly dire. The infection continued to spread, overwhelming the immune response of the affected twin. Sepsis set in, causing widespread inflammation and organ failure. Despite the administration of high-dose antibiotics, supportive therapies, and continuous monitoring, the twins' condition declined. The second twin, though free from infection, was increasingly weakened by prolonged respiratory compromise, fluid shifts, and stress from the first twin's decline. The medical team, despite their expertise and relentless effort, faced the tragic reality that both children might not survive. Decisions had to be made moment by moment, balancing the aggressive pursuit of life with the limitations imposed by the body's response to surgery and trauma. Ethical and emotional burdens weighed heavily on every clinician involved. Each intervention was executed with technical precision, yet the unpredictability of post-surgical physiology loomed as a constant threat. In the evening hours of the 7th day, the inevitable occurred. The twin struggling with the infection succumbed to sepsis, her tiny body unable to withstand the systemic collapse. The medical team moved quickly to support the surviving twin, yet the physiological stress and shared history with her sibling left her fragile and vulnerable. Despite maximum ventilatory and circulatory support, she too began to decline, overwhelmed by multi-organ failure and the cascading effects of surgical trauma. Within hours, both twins passed away. The room, once filled with the rhythmic beeping of monitors and the quiet hum of machines, fell into an unbroken silence. The surgical and nursing staff, exhausted and grieving, understood the magnitude of the loss. Outside the ICU, the parents were confronted with the unfathomable reality. Their children, whose lives had been the focus of extraordinary effort and hope, were gone. The aftermath reverberated beyond the hospital walls. News of the deaths of the Florida conjoined twins spread through medical and public communities, sparking discussions on ethics, surgical risks, and the limits of modern medicine. While the surgical separation had been technically accomplished, the tragedy of their post-operative decline highlighted the extraordinary fragility of such cases. Experts would analyze every detail, seeking lessons in anatomy, surgical planning, and post-operative care that could guide future attempts at separating conjoined twins. Even in death, the twins left a profound mark. Their case became a touchstone for discussions about the boundaries of medicine, the responsibilities of caregivers, and the ethical complexities surrounding high-risk interventions. The grief of their parents, mirrored by the sorrow of the medical staff who had fought tirelessly, underscored the human dimension of medical science, the way hope, expertise, and love converge in the crucible of life and death decisions. In the weeks following the twins' deaths, the hospital remained a somber place. Staff who had been part of the surgical team struggled with exhaustion and grief, haunted by the intensity of the operation and the knowledge that their extraordinary efforts had not been enough. Nurses who had cared for the twins around the clock found it difficult to return to routine duties, their memories of tiny, fragile bodies connected by tubes and monitors etched indelibly in their minds. Surgeons, anesthesiologists, and specialists who had meticulously planned every step of the procedure reflected on what could have been done differently, and whether the immense risk had been ethically justified. The parents, overwhelmed by grief, attempted to navigate the impossible task of mourning children whose lives had been at once intensely scrutinized and fiercely loved. Their memories were a mixture of the twins' brief moments of joy, coos, soft smiles, instinctive coordination, and the harrowing hospital experiences that had dominated much of their short lives. Friends and extended family offered support, but no words could bridge the gap between the hope they had held and the reality of loss. Counseling and grief support were brought in, yet even professionals acknowledged that the trauma was unlike any other. Beyond the immediate family, the medical community grappled with the implications of the case. Academic papers and case reports analyzed the twins' anatomy, the surgical procedure, and the post-operative complications in extraordinary detail. Conferences were held where physicians debated every decision: the timing of the surgery, the preparation, the surgical techniques, and the post-operative management. Scholars examined the ethics of attempting separation when the mortality risk was so high, and some questioned whether more conservative management, allowing the twins to live conjoined for as long as possible, would have been preferable. Yet, despite the tragedy, the case also contributed to medical knowledge in profound ways. The detailed anatomical studies provided insights into the shared organs of thoraco-omphalopagus twins that were previously unavailable. The surgical planning process, although ultimately unable to prevent death, highlighted strategies for coordinating multidisciplinary teams, monitoring shared circulatory systems, and managing anesthesia for conjoined infants. Every aspect of the case became a learning opportunity, informing protocols and surgical techniques for future attempts at separation. Ethically, the twins' story sparked broader conversations. Pediatricians, bioethicists, and surgeons debated the morality of attempting high-risk operations for the potential of independent life. The case became a reference point in medical ethics literature, illustrating the tension between innovation and human vulnerability, between hope and realistic outcomes. Hospitals across the country began reviewing their own approaches to rare congenital conditions, emphasizing detailed planning, parental involvement, and rigorous ethical review before undertaking comparable procedures. The media, which had reported on the initial birth and surgery with fascination, now approached the story with a more reflective tone. While early coverage had focused on the rarity and spectacle of conjoined twins, later reports examined the human costs and ethical dilemmas. The twins' short lives became symbolic of the fine line between medical possibility and mortality, inspiring both admiration for the courage of their parents and medical team and a sober acknowledgement of the limits of technology. In subsequent years, medical textbooks cited the Florida twins case as an early example of complex separation surgery, a case that demonstrated both technical ingenuity and the fragility of life. Pediatric surgical teams used the lessons learned to improve outcomes for future conjoined twins, particularly regarding circulatory management, post-operative infection control, and intensive care strategies. Hospitals developed protocols for long-term monitoring, infection prevention, and family support systems, informed in part by the twins' tragic outcome. The twins' legacy extended into the realm of public awareness as well. Their story highlighted the realities of conjoined twins, countering sensationalized depictions and emphasizing the humanity and vulnerability of these children. Advocacy groups and medical organizations used the case to raise awareness of congenital conditions, neonatal care, and the importance of multidisciplinary approaches in pediatric medicine. Though their lives had been painfully short, the twins' existence became a catalyst for knowledge, ethical reflection, and medical progress. Surgeons and parents alike carried forward the lessons learned, ensuring that future cases of conjoined twins could be approached with greater understanding, care, and preparation. Their story, marked by both human courage and the limits of medicine, remained a poignant reminder of the intersection between hope and mortality, and of the enduring responsibility of the medical community to learn from every life, no matter how brief. In the months following the deaths of the twins, the hospital environment settled into a quiet, reflective state. The intense flurry of activity that had defined the surgery and its immediate aftermath gave way to a somber routine, as staff processed the emotional weight of the outcome and administrators reviewed every procedural decision. Each member of the surgical team, surgeons, anesthesiologists, nurses, and technicians, found themselves revisiting the hours of the operation in their minds, analyzing every step with the dual perspectives of professional scrutiny and human grief. Hospital administrators convened a series of formal reviews to examine the entirety of the case. Internal investigations were launched to assess whether any procedural errors, oversight, or miscalculations had contributed to the tragic outcome. Every report, surgical log, and observation note from the day of the surgery was meticulously examined. The surgical team was interviewed extensively, asked to provide detailed recollections of each decision, every adjustment to anesthesia, and every intervention made during the operation. These reviews were not merely administrative. They were driven by the urgent need to understand what had occurred and to ensure that future attempts at similar procedures could benefit from lessons learned. Beyond the hospital, medical journals and academic institutions began to dissect the twins' case. Papers were written with painstaking attention to anatomical detail, outlining the complexities of thoraco-omphalopagus conjoinment. Surgeons documented the shared vascular structures, the nuances of liver division, and the delicate balancing of circulatory and respiratory support during separation. Anesthesiologists contributed analyses of how minute fluctuations in blood pressure, oxygenation, and drug metabolism affected the twins' stability. Each publication served both as a memorial to the lives lost and as a technical guide for future surgical teams. Ethical committees and bioethicists also engaged deeply with the case. Many discussions centered on the parents' decision to pursue surgery and the responsibilities of the medical team in recommending and executing such a high-risk intervention. Scholars debated the morality of elective separation when the probability of success was so low. Some argued that the pursuit of independent life justified the risk, while others emphasized that the twins' shared anatomy rendered true autonomy improbable and questioned whether the children's welfare had been compromised by the intervention. These debates influenced broader policies on pediatric surgical ethics, particularly in cases of rare congenital conditions. Meanwhile, the families of the twins became focal points for support initiatives. Counseling services were expanded to help them navigate grief and trauma, while hospital staff who had been intimately involved in the care of the twins were also offered psychological support. The emotional impact of losing two children under such extraordinary circumstances was profound, and the hospital recognized that the human cost extended beyond the parents to every caregiver who had been present throughout the journey. Support groups for families of conjoined twins and parents of children with high-risk congenital anomalies cited the Florida twin story as both a cautionary tale and a point of connection, acknowledging the shared experience of hope, risk, and loss. Public attention, though waning from the initial media coverage, persisted in academic and medical circles. Lectures were held at medical schools, illustrating the complexities of pediatric surgery and the challenges inherent in separating conjoined twins. Surgeons recounted the technical challenges faced, from the intricacies of shared vasculature to the difficulties in postoperative care. These lectures emphasized not only the technical and physiological lessons, but also the ethical and human dimensions of such cases, underscoring the importance of comprehensive preparation, family counseling, and interdisciplinary collaboration. In addition, research inspired by the case began to take root. Scientists examined historical cases of conjoined twins, comparing surgical techniques, survival rates, and postoperative management strategies. The Florida twins case provided critical data on infection control, circulatory management, and the physiological stresses unique to separation surgeries. Hospitals and research institutions used this data to simulate operations, develop training modules, and refine protocols for future cases. The tragic outcome became a reference point, ensuring that the knowledge gained could improve the prospects of other children in similar circumstances. The surgical team, while initially burdened with grief, gradually channeled their experience into teaching, research, and advocacy. They wrote extensively, sharing insights on operative strategy, the coordination of multidisciplinary teams, and postoperative care. Seminars and conferences allowed them to convey both technical expertise and emotional understanding, helping other clinicians navigate the tension between innovation and risk. Their reflections emphasized humility in the face of medical uncertainty, highlighting that even the most careful planning could not eliminate the inherent dangers of pioneering surgery. Throughout these reflections and investigations, the narrative of the twins became a lens through which broader societal questions were examined. The case highlighted how advances in medicine can confront the limits of human physiology, ethics, and parental decision-making. It also underscored the profound responsibility borne by healthcare providers when managing extraordinary cases. Every decision, every intervention, and every recommendation was scrutinized not only for technical accuracy, but also for its moral and emotional implications. Finally, the story of the twins began to take on a more lasting significance. They became a symbol of the delicate balance between human ambition and vulnerability, demonstrating both the heights of medical skill and the limits imposed by biology. Memorials, case studies, and educational programs ensured that their brief lives continued to teach, influence, and inspire. Each new generation of pediatric surgeons and bioethicists learned not only the technical lessons but also the enduring human lessons: courage, hope, empathy, and the awareness that even in failure, lives can contribute to the advancement of knowledge and the care of others. The death of the twins rippled far beyond the walls of the Florida hospital, stirring intense debate among medical professionals, ethicists, journalists, and the general public. Conferences and symposia were convened across the country to examine the ethical questions raised by the surgical separation and its tragic outcome. The case became a touchstone for discussions about pediatric consent, parental rights, and the limits of medical intervention in high-risk situations. Scholars, some sympathetic to the parents' decision and others critical, scrutinized every aspect of the operation. At the heart of the debate was the question of whether the parents had made a fully informed choice. Experts weighed the enormity of the risk against the potential reward: independent life for their children. Some ethicists argued that the parents' decision was courageous, rooted in love and a desire to provide their children with autonomy. Others contended that placing two infants through an 18-hour operation with near-certain danger to both was morally fraught. Discussions delved into the nature of parental responsibility, the limits of medical authority, and the tension between hope and realism. Within the hospital, the surgical team faced their own moral reckoning. Surgeons reviewed every decision with painstaking care, re-examining choices made under extreme pressure. Was there any point at which an alternative approach could have improved outcomes? Could preoperative imaging have been more thorough? Could postoperative care have prevented the rapid deterioration from infection and respiratory distress? These questions were dissected not as accusations, but as part of a rigorous process to refine protocols and preserve life in future cases. The media played a pivotal role in shaping public perception. Initial reporting had framed the twins' birth and surgery as remarkable and almost miraculous, focusing on the technical skill required for such a rare procedure. But as news of the twins' deaths spread, reporting shifted to highlight ethical concerns, parental decision-making, and the limits of medical science. Newspapers and magazines carried editorials debating whether the pursuit of separation had been justified, raising questions about the responsibility of physicians to weigh risk against potential benefit. Radio and television segments featured interviews with ethicists, pediatricians, and the parents themselves, all attempting to make sense of a profoundly tragic event. Medical schools and teaching hospitals began using the case as a foundation for ethics courses. Students were presented with the twins' medical charts, surgical notes, and post-operative reports. They were asked to consider questions that had no easy answers. Could the operation have been delayed to allow further growth and development? Was there an alternative palliative approach? How should families, doctors, and ethicists collaborate in high-stakes, life-or-death decisions for children who cannot consent? These lessons, often emotionally charged, were intended to instill not just knowledge, but empathy, judgment, and ethical sensitivity. Professional organizations also took note. Pediatric surgical societies convened special committees to study the twins' case, creating guidelines for evaluating future conjoined twin separations. These guidelines emphasized thorough anatomical analysis, multidisciplinary planning, risk assessment, and, crucially, ethical consultation. Hospitals adopted policies requiring independent ethical review boards before undertaking any procedure with a high probability of mortality. The Florida case became emblematic of the tension between innovation and responsibility, a vivid illustration of the consequences of operating at the edge of medical possibility. Public reaction was equally complex. Supporters of the parents' decision viewed the operation as a bold, compassionate choice, emphasizing the hope that their children could experience life as individuals. Critics, however, saw the surgery as unnecessarily risky, questioning whether the parents and doctors had been guided by scientific curiosity rather than the children's welfare. Letters poured into newspapers, some offering condolences, others voicing moral outrage. Community forums and church gatherings debated the ethics of high-risk pediatric surgery, with the twins' story serving as a focal point for discussions about faith, morality, and the responsibilities of human intervention. Within the hospital, staff members struggled with lingering emotional trauma. Nurses who had attended to the twins around the clock recalled every small detail, the way the infants instinctively moved together, the moments of quiet contentment in the midst of relentless medical monitoring. Surgeons carried the memory of their precise hands working for 18 hours, balancing life and death on the thinnest of margins. Even technicians and assistants, often overlooked in narratives of medical heroism, bore witness to the intensity of care and the heartbreak of loss. Counseling and peer support were offered, yet the psychological weight of such an unprecedented outcome remained profound. Amid these debates, the twins themselves became central figures in discussions of human dignity and medical ethics. Advocates emphasized their individuality, their right to life, and the moral imperative to attempt every possible intervention. Critics highlighted the unpredictability of medical outcomes, the inherent dangers of complex surgeries, and the ethical responsibility to avoid harm when the likelihood of survival was so uncertain. Every argument, every case study, and every ethical discussion revolved around the delicate intersection of hope, science, and moral duty. The Florida twins case also influenced future policy decisions. Hospitals incorporated mandatory counseling for parents facing similar decisions, established clearer communication protocols, and emphasized collaborative planning across specialties. Training programs for surgeons and anesthesiologists began to include modules on conjoined twin separation, with explicit attention to ethical considerations. The story of the twins became both a technical reference and a cautionary tale, demonstrating the enormous responsibilities carried by medical professionals, the stakes of parental choice, and the unpredictable fragility of life. Across academic journals, conferences, and classrooms, the case was dissected repeatedly. Each discussion reinforced the importance of humility, meticulous preparation, and ethical vigilance. Surgeons cited the operation as a historical turning point in pediatric separation surgeries, highlighting the lessons learned from both its technical successes and its tragic failures. The twins, though gone, had become enduring figures in the evolution of medical ethics and surgical practice, their story woven into the fabric of professional reflection and societal debate. In the years that followed the Florida twins' tragic deaths, their case continued to resonate throughout the medical community, driving innovation, research, and improvements in surgical practice. Hospitals and academic institutions revisited the detailed documentation of their separation attempt, analyzing every element from preoperative imaging to postoperative monitoring. While the immediate outcome had been devastating, physicians recognized that the knowledge gained could prevent similar tragedies in the future. The first area of advancement was in imaging and anatomical mapping. Before the twin surgery, medical imaging was limited in its ability to reveal the intricate connections between shared organs and blood vessels. Surgeons relied on X-rays, basic ultrasounds, and exploratory procedures that provided incomplete information. After the Florida case, radiologists and pediatric surgeons collaborated to develop more sophisticated techniques. Angiography was refined to visualize shared circulatory systems in greater detail, and three-dimensional reconstruction methods were explored to model how organs overlapped and functioned together. These imaging improvements allowed future surgical teams to plan with unprecedented precision, reducing the likelihood of unexpected complications during separation procedures. The case also prompted innovations in surgical planning and team coordination. Prior to the Florida twins, most conjoined twin separations were conducted with a primary surgeon overseeing the entire procedure, while assistants played supporting roles. In the wake of the twins' surgery, hospitals began establishing truly multidisciplinary surgical teams for complex cases. Surgeons from multiple specialties, including pediatric, cardiothoracic, and abdominal surgery, worked simultaneously, coordinated through detailed protocols. Operating rooms were redesigned to accommodate multiple surgeons, specialized equipment, and rapid response support, creating an environment where complex separations could proceed more safely. Anesthesia protocols underwent significant revision as well. The Florida twins had required an extraordinarily delicate balance to maintain oxygenation, blood pressure, and heart function for both children simultaneously. Anesthesiologists recognized the limitations of existing techniques and began experimenting with methods to independently monitor and adjust anesthesia for each twin during separation. New monitoring equipment was developed, capable of tracking vitals for multiple patients at once, and guidelines were introduced for titrating anesthetics in cases of shared circulation. These advancements significantly reduced the risk of sudden cardiovascular collapse in future surgeries. Postoperative care also evolved in response to the lessons learned from the Florida twins. Intensive care units began implementing specialized protocols for conjoined twin separations, including strict infection control measures, continuous hemodynamic monitoring, and early interventions for respiratory distress. Hospitals developed guidelines for staffing, ensuring that a sufficient number of critical care nurses and physicians could provide continuous, focused attention. These changes aimed to prevent the rapid deterioration that had claimed the lives of the twins, highlighting the importance of sustained, vigilant care after high-risk operations. The case spurred research into congenital anatomy and physiology. Pediatric surgeons and developmental biologists studied thoraco-omphalopagus twins to better understand how shared organs functioned, how circulatory systems interacted, and how organ division could be achieved without catastrophic compromise. Animal models and computational simulations were used to explore separation strategies, allowing surgical teams to practice and refine techniques in controlled environments. This research informed future surgeries, providing a knowledge base that directly improved survival rates for subsequent conjoined twins. Education and training also benefited from the Florida twins story. Medical schools incorporated the case into curricula for pediatric surgery, anesthesiology, and bioethics. Students studied the operation step by step, analyzing decisions, complications, and ethical considerations. Surgical residents were trained to anticipate the kinds of challenges presented by shared organs, unexpected vascular anomalies, and postoperative care. Simulation-based training became more common, enabling future surgeons to rehearse procedures virtually or in anatomical models before operating on live patients. In addition to technical advances, the Florida twins case prompted a cultural shift within the medical community. Hospitals and surgical teams became more aware of the importance of transparency, parental involvement, and ethical consultation. Families were increasingly included in decision-making, receiving detailed explanations of risks, benefits, and potential outcomes. Hospitals developed ethics committees specifically tasked with evaluating high-risk pediatric surgeries, ensuring that decisions were informed, collaborative, and ethically sound. This focus on communication and moral responsibility became as important as technical skill in the management of conjoined twins. Internationally, the case influenced surgical practice worldwide. Pediatric surgical societies shared findings from the Florida twins operation, disseminating knowledge through journals, conferences, and collaborative networks. Surgeons in Europe, Asia, and South America applied lessons learned to their own cases, improving outcomes and reducing mortality rates. The twins' story transcended geographic boundaries, contributing to a global understanding of the complexities inherent in conjoined twin separation. Even as medical techniques advanced, the Florida twins remained a poignant reminder of the human cost of surgical innovation. While subsequent operations achieved greater success, the emotional resonance of their story reinforced the necessity of careful planning, ethical vigilance, and empathy in medical practice. Their lives, brief though they were, became a catalyst for progress, a tragic spark that ignited developments benefiting countless children in the decades to follow. The story of the twins also inspired research into long-term outcomes for conjoined twin survivors. Studies examined psychological adaptation, physical rehabilitation, and social integration after separation, ensuring that advances in surgery were accompanied by holistic approaches to care. Multidisciplinary teams began to include psychologists, physical therapists, and social workers, recognizing that survival alone was not enough. Children separated from conjoined states required comprehensive support to thrive. Through these technical, ethical, and educational advancements, the legacy of the Florida twins became firmly embedded in the medical world. Their case demonstrated the delicate balance between courage, innovation, and human vulnerability, highlighting the extraordinary complexity of pediatric surgery. Each lesson learned, each protocol revised, and each new surgical success carried the imprint of their brief lives, ensuring that the knowledge gained would continue to safeguard the health and well-being of children facing similar challenges. The story of the Florida twins, though centered in a single hospital and a specific surgical team, reverberated far beyond the medical community. Families of children with congenital anomalies, parents of high-risk infants, and support networks for children with complex medical needs all took notice. Their story became a touchstone, illustrating both the extraordinary possibilities of modern medicine and the immense risks inherent in high-stakes interventions. For parents of other conjoined twins or infants with critical conditions, the Florida case was both cautionary and instructive. Hospitals began implementing family counseling programs, ensuring that parents understood not only the medical procedures proposed, but also the ethical, emotional, and psychological dimensions of their decisions. Support groups emerged, where families could share experiences, concerns, and hopes. The twins' story was frequently referenced in these discussions, offering insight into the kinds of challenges families might face, navigating uncertainty, weighing risks, and coping with potential loss. At the societal level, public conversations shifted toward a nuanced understanding of medical possibility. Newspapers and magazines published reflective pieces exploring the ethics of pediatric surgery, the limits of technological intervention, and the responsibilities of physicians toward their youngest patients. Letters to editors and opinion columns sparked debates in communities about how much risk was acceptable in the pursuit of life. Religious and philosophical forums grappled with the moral questions. Was it right to attempt a separation when both children might die? Did the pursuit of independence justify extraordinary surgical risk? The story of the twins provided concrete grounding for abstract moral questions, making ethical dilemmas tangible to the public. Educationally, the case became an essential part of teaching both in medical schools and in ethics programs. Pediatricians, nurses, surgeons, and bioethicists analyzed every aspect of the twins' experience, from anatomical complexity to parental involvement to post-operative care. Students were presented with detailed timelines, surgical logs, and outcomes data, and asked to consider difficult questions. How would you advise the parents? What interventions could have minimized risk? How do we balance hope with realistic outcomes? These discussions emphasized critical thinking, empathy, and moral responsibility, shaping the next generation of medical professionals. Culturally, the Florida twins' story influenced literature, art, and media representations of conjoined twins and complex pediatric surgeries. While earlier depictions of conjoined twins often veered toward sensationalism or spectacle, the narrative of these children highlighted the human dimensions, vulnerability, family devotion, and the moral complexity of medical intervention. Documentaries, academic papers, and lectures portrayed the twins not as curiosities, but as children whose lives, though brief, provoked deep reflection about medicine, morality, and human resilience. The parents themselves, though deeply grieving, became informal advocates and voices for awareness. They spoke in private forums and occasionally contributed to discussions about pediatric ethics, emphasizing the need for compassionate communication and parental inclusion in high-risk decisions. Their reflections underscored the dual reality of hope and tragedy, that decisions made in love, guided by expertise, could still result in loss, and that families needed support in navigating the emotional and ethical dimensions of such circumstances. Hospitals integrated the lessons from the Florida twins into long-term policy. Ethics committees were strengthened, requiring multi-tiered review for any proposed surgery with extreme risk. Communication protocols were formalized, ensuring parents received detailed information, time to process options, and counseling support. Staff training incorporated not only technical instruction, but also emotional resilience and strategies for coping with patient loss. The twins' story became a template for how institutions could learn from tragedy, emphasizing preparation, reflection, and the integration of ethical reasoning with clinical expertise. Internationally, the case influenced guidelines and protocols for conjoined twin management. Pediatric surgical societies referenced the Florida operation in manuals, workshops, and conferences, underscoring both the technical and ethical dimensions. Surgeons in other countries studied the post-operative challenges faced by the twins, implementing preventive strategies such as enhanced infection control, improved circulatory monitoring, and integrated post-surgical care teams. The twins' experience informed not just surgery, but a holistic approach to the treatment of complex pediatric conditions. The story of the twins also prompted reflection on the social perception of medical innovation. While the procedure was a technical milestone, society was reminded that scientific progress carries human consequences. Media outlets, educators, and medical professionals used the twins' case to illustrate the intertwined nature of innovation, risk, and responsibility, helping the public appreciate the profound stakes involved when medicine pushes the boundaries of what is possible. Through all of these dimensions, family support, ethical reflection, educational development, cultural representation, and public discourse, the Florida twins' story persisted as a catalyst for discussion and reform. Their lives, brief and intensely scrutinized, left a legacy not only of medical insight but of moral and social awareness. Their story encouraged society to consider carefully the responsibilities inherent in scientific and medical advances, emphasizing that progress must be accompanied by reflection, compassion, and ethical rigor. As the years passed, the Florida twins' story solidified into a complex legacy that touched every corner of medicine, ethics, and society. Pediatric surgeons, anesthesiologists, critical care specialists, and bioethicists continued to study the details of their case, analyzing every moment of the operation and its aftermath. Despite the tragic outcome, the twins became central figures in understanding both the capabilities and limits of modern medicine. Their brief lives, and the extraordinary attention paid to them, provided a foundation for advancements that would save countless others. Hospitals and academic institutions incorporated their case into curricula for generations of medical professionals. Students studied intricate diagrams of shared organs, circulatory systems, and surgical approaches, often rehearsing procedures in simulation labs informed by the twins' anatomy. Discussions emphasized not only technical proficiency, but also the importance of vigilance, preparation, and collaboration across multiple specialties. The lessons learned underscored that no surgical skill alone could guarantee success. Continuous monitoring, meticulous planning, and ethical consideration were equally vital. The ethical implications of their case continued to influence the way pediatric care was approached. Ethics committees became standard in hospitals handling rare and complex congenital conditions, tasked with weighing risks, benefits, and alternatives. Parental counseling protocols were strengthened, ensuring families were not only informed but fully supported in making high-stakes decisions. The story of the Florida twins was cited repeatedly as a benchmark for understanding the delicate balance between medical possibility and moral responsibility. Medical journals carried detailed analyses of the twins' surgery, examining why post-operative complications, such as infection and respiratory distress, had proven fatal. Researchers used these insights to refine post-surgical protocols, emphasizing early intervention for sepsis, advanced respiratory support techniques, and precise hemodynamic monitoring. Pediatric intensive care units around the world adopted these practices, reducing mortality in subsequent conjoined twin separations. The Florida twins case became a guiding example of how tragedy could catalyze progress, ensuring that every lesson learned was translated into safer, more informed medical care. Culturally, the twins' story continued to resonate. Educators, writers, and filmmakers approached the narrative not as a spectacle of rarity, but as a study in human courage, love, and ethical complexity. Their lives, marked by vulnerability, parental devotion, and the efforts of countless professionals, highlighted the profound responsibility inherent in medical innovation. Public discourse emphasized that scientific progress must be accompanied by empathy, ethical reflection, and careful deliberation, shaping the way society viewed the responsibilities of medicine and technology. For families of other conjoined twins or children with high-risk conditions, the Florida twins became both a warning and a guide. Support networks and advocacy groups referenced their case when discussing the challenges of decision-making under uncertainty. Parents were encouraged to ask questions, seek second opinions, and engage in thorough ethical consultation. Hospitals emphasized that families' voices were central to planning, ensuring that decisions balanced medical insight with love, hope, and realistic expectations. The medical team involved in the twin surgery carried their experience forward, using it to educate colleagues and improve patient care. Surgeons, anesthesiologists, and nurses shared first-hand accounts of the operation, the challenges encountered, and the emotional impact of the outcome. These narratives reinforced that technical skill, while critical, must be complemented by communication, ethical judgment, and emotional resilience. Lessons learned from the Florida twins became integrated into continuing education programs, ensuring that each generation of professionals was informed not only by science but by lived experience. Internationally, the twins' story shaped policies for conjoined twin management. Hospitals adopted standardized protocols for preoperative imaging, team coordination, anesthesia, and post-operative care. Ethical review boards became customary, ensuring that all proposed high-risk interventions were evaluated from multiple perspectives. Pediatric surgical societies cited the Florida case in manuals and conferences, emphasizing both the technical lessons and the moral imperatives highlighted by the tragic outcome. The story also prompted reflection on the nature of hope in medicine. Families, doctors, and society at large learned that hope could coexist with caution, and that pursuing life-saving interventions did not guarantee survival. The Florida twins' lives illustrated that medical care is as much about human connection, ethical reasoning, and moral courage as it is about technical expertise. Their brief presence compelled professionals and laypeople alike to confront the weight of responsibility inherent in life-and-death decisions. Ultimately, the Florida twins became emblematic of the intersection between human vulnerability, parental devotion, medical ambition, and ethical responsibility. Their story endured not as a tale of failure alone, but as a profound reminder of what is at stake when lives are entrusted to the intersection of science, hope, and moral judgment. Every surgeon trained, every guideline revised, and every family counseled in the decades following their deaths carried the imprint of their brief existence. Their lives, though tragically short, ensured that knowledge, compassion, and reflection would continue to guide the care of children in the most extraordinary circumstances. Thank you for watching and sharing in this story with me. If it resonated with you, make sure to like, subscribe, and turn on notifications so you never miss a tale that leaves its mark. And don't forget, join the conversation in the comments and tell us what story you want to hear next, here on Eternal Obsidian.